wouldn't mind just being a body for me for this. So, we're going to look at the process that we would make if we come across, it's actually two scenarios. It's if we come across somebody that is unconscious, they're lying on the floor, but they are breathing. The other scenario is that if we're using CPR and our casualty suddenly regains consciousness or begins to have a heartbeat on their own or breathe on their own. So those are the two scenarios. So Tom, bravely volunteered, well done. Lie down on your back. Now, it doesn't really matter with the dummy because you can't really kill the dummy, but we'll wish Tom all the best with this. So we're going to come back now, we're back into the scenario that we were. So first thing I'm going to do is check for danger, and then I'm going to check for, okay. Anyone remember what that acronym was? AFPU, right? See whether or not it was alert. And I'm going to say, hello, can you hear me? Open your eyes if you can hear me, okay? If I have no response, the next thing I'm going to do is just check his airway to see whether or not there's anything in his airway. If his airway is clear, I'm then going to do what?
Listen for and check for breathing.
I'm then going to make sure I bring him up and I tip the head back slightly, the cheek, my ear, to the mouth and nose, look along the line of the chest. Good news, okay? He's breathing, okay? So now what I'm going to need to do is to try and get some idea as to why he might be lying there. It's called a secondary survey, okay? Now I'm going to start by taking my hands, gloves whenever possible of course, and I'm going to run my hands around the head and the base of the neck, okay? And I'm going to check by looking into his ears, okay, to see whether or not I can see any form of discharge coming from the ear, okay? A light straw-like blood coming out of the ear usually indicates a skull fracture. Not good news, okay? So I'm going to check around, and when I get to the base of the skull here, just bringing my hands down into the base of the neck. Why might I check the bottom of his neck like that?
Because if the neck's broken, it'll be on the floor. It'll still be in position.
Yeah, because if I ask Tom to try and get the lower part of his neck where my hand is flat against the floor, can you get it flat against the floor? I can't do it, okay, because the cervical's got a bend in it. If that's flat to the floor, it usually indicates a broken neck, okay? So if we do that, and we find that it is flat, and we suspect we see some straw-like blood coming out of the ear, we're going to move them? No. Okay? So I'm going to check around the head, check around the neck, check the ears, and once I've done one part of the body, I'm going to look at my hands. Why would I look at my hands? See whether or not there's any blood, okay? Then I'm going to move up to the upper body. I'm going to be pressing to see whether or not I can feel any form of abnormalities. I take one arm. Now, don't pat. If you pat, you might miss something, okay? So check by running your hands down, checking the fingers. When I get here with Tom, I'm going to just take his sleeve up and look at his wrist. Why would I do that?
Check for
any form of medical bracelet or anything like that. And we're being very careful as we go along the body. And then I'm going to check the sternum, the centre of the chest. Always a good idea just with the back of the hand. Just apply a little bit of pressure and see whether or not there's any form of response, because pain is one of the last things that an unconscious person, the response to pain is one of the last things an unconscious person would lose. So even they might be unconscious, they might flinch when you come across something that is painful. I'm checking again. Might check the abdomen as well to see if there's anything there. I'm checking my hands all the time. Every time I do one part of the body, I check my hands, okay? Move down, check the leg. See whether or not there's anything that's abnormal, both legs. Okay? And if I find nothing, it's safe to assume then that I need to take my casualty over into what's known as the recovery position, which is a safe position, which is going to maintain his airway and allow for any drainage should I need that, okay? Now the way that we're going to do that, do you have a question? Yeah.
I've always been taught you have to apply a bit of pressure or feel the hips.
Okay, they're bringing the hip rock out. They're taking the hip rock out, okay, because they're concerned about spinal injuries if you move the hip. I mean, if you get to a position like this and you can't feel anything through the back like that, you know, sort of moving, because if someone's got a spinal injury, do you want to move them? No. So they're starting to take the hip rock out. Yeah. Okay, so I'm going to turn him over into the recovery position. So I'm going to take this arm. I tend to lay that arm. Some people do it in a stop traffic way, which is fine. That's perfectly all right. And some people have it straight. I mean, either is fine as long as it's effective. That's okay. And I'm going to take his opposite hand, bring his opposite hand up, so I place it up by his cheek. Reach down, take the knee, and I'm going to lift his leg up. You're unconscious, Tom. Lift his leg up, and then I'm just going to pull this leg over and watch what happens. And even if you've got quite a large person, it's genius whoever invented this. I'm going to shuffle my knees back and bring him over into this side position. I'm going to bring this knee up, pull this knee towards me, and then very carefully I'm going to place his hand down on his head, making sure that he has that slight tip. Do you see this tip to the head? Because this helps to maintain that airway. And then I just make sure that we've got a little bit of room in there, and I have him in this recovery position now, and it's this point that I go and get the ambulance. Okay? So do you see that you get to a certain point and the paths split depending on what's happening? Because the priority is always ABC. So if there's no breathing and there's no circulation, you have to crack on with CPR. Okay? And that's sometimes people fall asleep, Tom. And that's the recovery position. Okay? Right, does anyone would like to try putting someone else in the recovery position? And going through there. Who didn't do the CPR? Right. Right. Come on, someone's got to do it. Alex, lie down. AJ, give it a go for me. Come on. Good man. So the first thing you're going to do, AJ, is you approach and look for danger. You assess the danger. And then the second thing you're going to do is
see if they're responsive.
See if they're responsive. Off you go.
Hello, can you hear me? Hi.
Perfect. So he doesn't respond. The next thing we're going to do is check.
If he responds to pain.
That's right. Yeah. So you part of your AVPU, give it a little press. Can you hear me? Reaffirm with your voice. Can you hear me? Open your eyes if you can hear me.
Can you hear me? Open your eyes.
Perfect. No response. Okay. Then we're going to check what?
Obstruction in the airway.
So we're going to open his mouth. We don't need to pinch the nose at that point. Just need to open the mouth.
Yep.
The good news is unconscious people, their mouth opens very easily. Okay. So we're checking there. Can't see anything there. Next thing we're going to do is
check breathing.
That's it. So to check breathing, we're going to tip him back a little bit to open his airway right up. Yep. And then we're going to put our cheek and our ear and look along the line of the chest. How long for?
10 seconds.
10 seconds. Good news, AJ.
He's breathing.
He's breathing, okay? So then we're going to do what?
Secondary survey at that one because
That's
he's breathing.
it, yeah. So he's breathing. There you go. So first thing let's say he was wearing a hat, what would you do?
See, that's where I'm confused though, because you know, like if it's a helmet or something, you don't touch it.
No.
But if it's a cyclist helmet, would you do it then, or would you leave it? Or?
No. If it's a cyclist helmet, the best thing to do with a cyclist helmet is to leave it on. But the good thing about cyclist helmets, they have air vents and gaps in them. Okay, so you can peek through the gap to see whether or not you can see. And also with head injuries as well, if there is a significant head injury, you're going to see blood around in the area as well, okay? Well, what I wouldn't be doing is taking off his hat and pulling his hat off for sure. But I would just check with my hands on the outside of the hat to see whether or not there's any bleed through. Because trust me, with a hat like that, if he had an head injury, there would be bleed through, okay? So you check, you're going to check around the neck as well.
Yep.
And then once you get to one area of the body, you're going to look at your hands.
Yep.
Perfect. Then you're going to go onto the torso. Back of the hand is always a good idea, especially if you're dealing with a lady, just in case it turns out that actually they weren't, they were just in a deep sleep. Okay, you check around the rib cage, and every time you do that, you're bringing your hands up just to look perfect, okay? We move on to the arms. And again, don't pat the arm, don't pat the leg, run your hand along it, get to the wrists, you're going to check, see whether or not there's any bracelets on there, you might have a look at the fingers. Very, very careful as you reach the other side of the body as well, okay? Sometimes people get up and walk around if it's difficult for you to reach over. We check all the way down, trying to get our hand right the way around the arm. We check for bracelets again, looking up palm of the hands. Perfect. Very good.
Is there anything particular we're looking for on the fingers?
No, I mean, at the end of the day, if someone has a form of broken fingers, that's the least of their problems, perhaps if they're unconscious. But what might you see on someone's hand that's unconscious?
A burn.
You might see electrical burns, okay? So what you're aiming to do is to give the paramedic as much information as you can when they arrive, okay? So if you say, well, unconscious when I found him, he seems to have a really bad burn on his hand, you know? Yeah, they're used to
Save time
scenarios,
for them,
yeah. But that said, you know, if there is an electrical issue, you've got to be very careful of your own safety, because how did that person get that shock and how did they end up on the floor, you know what I mean? So you've got to look for wires and cables and that kind of stuff, okay? We'll go down one leg then the other.
Yeah. Is it same again? Don't pat it. Feel all the way down.
Feel all the way down. So you're looking for any form of abnormality, anything sticking out, anything bleeding. Yeah. Get right down to the end. Check your hands when you get to the end. Perfect. Yeah. Perfect. So far then, what we know about him is his breathing. He's unconscious, but he is breathing. Okay. So we can't find anything at all. So we're going to move him. Okay. Take the closest arm, bring it out to the side, but you can stop traffic. Some people can't get their arm flat. If that happens, to straighten the arm, that's fine. Take the opposite hand, you go palm to palm, and you take it up to his head. Perfect, very good. Reach down to his trouser leg, pull up his knee, his foot goes flat on the ground, and then as you rock that knee towards you and you turn him onto his side, you just shuffle back with your knees. Over he comes. Perfect, very good. We're looking for that slight head tip to make sure that it maintains his airway and helps for any drainage, meaning if he's sick or anything like that.
So with the legs, would you bring, where it's crossed over like that, would you bring it round? And
Yeah, I mean, there's no hard and fast rule to it. He's in a recovery position. He's in a better position than he was. But one of the things you've got to be careful of course, is that if he's not in a perfect position, he could roll back. Because once his upper body starts to turn, his legs will go. So to be absolutely sure that he's not going to, if you do that, there's no chance of him rolling back the other way. Okay? Any questions on that? Perfect, what a great actor. Excellent. So we come back then, we're nearly done.